Let's talk about complaints and private clients because this is one thing a lot of services underestimate. A complaint isn't actually the biggest risk, your response system is. Because when a complaint comes in, that's the moment your governance gets tested. It's not your policy on the shelf, not the version saved in a folder, your actual system. And in private clinics, I don't know why I see this all the time, but this is something that is really often overlooked and people miss this. By the way, I'm Lindsay. I create compliance confidence for health and social care providers by translating governance and CQC requirements into practical systems, actions, and evidence. So yes, your policy might mention a 3-stage process, but if you've referenced a 3rd stage like ISCAS, you need to make sure you're actually signed up. Don't just write it into your complaints policy and assume that gives you automatic subscription, because it doesn't. So if a complaint escalates, can you clearly evidence stage 1, stage 2, and if needed, access to that independent 3rd stage? That matters. And the other thing that I see is evidence of learning. That doesn't necessarily mean that you write staff reminded of and then move on. It is real evidence of learning, a real documented investigation, a clear outcome, changes made to practice or process if necessary, a staff briefing or training, something to show that, you've taken the complaint really on board, because that's what good complaint handling looks like. Not just responding, learning, evidencing, and improving. Save this and share this with your manager.